So what we'll do is we'll have patients come in and we have them do specific types of exercises. We call it exercise with oxygen therapy. And what will happen is they'll put this cannula on. It just comes right around this way and into their nose. And what will happen is they'll be breathing in 90% oxygen through an oxygen concentrator. So it's not really tanks, but what it does is it takes the oxygen in the air and compresses it down and turns it into 90% oxygen. The normal amount of oxygen in the typical air we breathe is about 20%. So when you breathe this in, it really lights up the brain. It improves the function of the brain. And when we do specific activations or specific types of therapies at the same time when a patient's on oxygen, what that does is causes those nerves to develop healthy sprouts of dendrites and neurons. So what happens is those nerves develop more efficient pathways. So if, let's say, the lower brainstem isn't firing well, we'll activate that. The lower brainstem will get oxygen, and that lower brainstem will start to rise up and improve its ability to function. So the next time when you have a demand in the occipital lobe and a migraine may be coming on, if that lower brainstem is firing well, what's going to happen is it's going to send a message right up to the lower, to the occipital lobe, and those occipital lobe blood vessels are going to dilate exactly to the amount necessary based on how much oxygen needed. That's what happens in a normal person's brain, or a person's brain that doesn't have a functional physiological lesion. Now, so oxygen therapy is absolutely critical. The other thing that we do is we want to do specific types of stimulations. Okay, so if a patient comes in and we find that they've got some choppy pursuits as they look at a target on the real eyes examination, what we'll do for their therapy is they may do specific types of eye exercises to train the parts of their brain that aren't quite working the way they need to work. We may do specific light adjusting. And the reason why we do specific light adjusting is we may use something called an arthrostim. And this is a very gentle way to come in the spine and stimulate some of the joints that are in the spine. In the spine you have what's called mechanoreceptors. So if we find out that the right cerebellum is not firing well, we can stimulate the joints on the right side of your body very lightly, and that'll send a message up to the cerebellum, and the cerebellum will then be activated, and then what will happen there is it'll start to develop better, healthier pathways. We can also do vibration on one side. We can have you, which really does the same thing. It fires off these joint receptors, which then stimulates the cerebellum. We can have you do balance training. So some of the other therapies that we can do to have you stimulate the cerebellum would be what we call complex nonlinear movements. One of those things would be having you look straight ahead and having you write out alphabets or draw pictures in the air. That may stimulate the right side of the cerebellum, which then will fire over to the left brain. We also can have you use a squeeze ball on one side. Another thing that we can do to stimulate the cerebellum is to stimulate the vestibular portion of the cerebellum using what we call a warm water caloric. And with a warm water caloric, what we'll do is just have you put warm water, one of our assistants will do that, or I will do that. We'll put warm water in the outer ear here. And what that does is it warms up the kinocilium and the stereocilia. And what that does in the inner ear is it will fire off the vestibular nerve. The vestibular nerve then goes right into the cerebellum, and it's a great way to stimulate not only the cerebellum, but to stimulate the lower brainstem. It's a great therapy to be used for patients with not only migraine headaches, but dizziness and things of that nature. So that's what we do. Another thing that we do that is a great therapy for patients with migraines is we'll use what's called auricular therapy. And what auricular therapy is it's acupuncture, electrical acupuncture points that we do on the ear. Now there's no needles with this, but what it does is it creates sort of like a little vibration or stimulation on the outer lobe of your ear. And what that will do is it'll stimulate cranial nerves 7, 9, and 10. Now cranial nerves 7, 9, and 10, the nuclei of those nerves reside in the lower brainstem. So if we stimulate the skin on the outside of the ear with these acupuncture points, it's going to raise the frequency of firing of the lower brainstem. Now by doing that and increasing the other areas of the brain, that's going to help to reduce the migraine headaches and to, in a lot of cases, eliminate migraine headaches altogether, because again, migraine headaches are a neurological problem. Again, frontal lobes have a lot to do with migraine headaches. So one of my favorite therapies to use is something called the interactive metronome. Now, the interactive metronome is a tool that we use with a lot of our patients. So we use it for patients with Parkinson's disease, we use it for patients with MS, we use it for patients that have attention deficit disorder. It's great with kids with autism and dyslexia. But it's also very good with patients with migraine headaches, because what happens is it's a computer-based program, and you put this hand trigger on like this, and you put the headphones on. And what the headphones do is they're going to put a little reference tune. There's going to be a reference beat that's going to go into, you're going to hear it in your ears, okay? And what you have to do is you have to hit right on that reference tune down to the millisecond. So you're developing what's called rhythm and timing. Now, your ability to have good rhythm and timing resides in your brain. It resides in the cerebellum, but it also resides in the frontal lobes. And so the interactive metronome, which you can learn more about at interactivemetronome.com. But what that does is it's an excellent, especially right brain frontal lobe therapy. And when you do this, you actually get a score each time you do it as to how close you are to the reference beat. And it's down to the millisecond. It sounds kind of easy, but it's really tough. And what happens is, as you get better at doing this, you're developing better and stronger pathways in your brain. It's also, like I said, it's good for Parkinson's patients because the frontal lobes have a lot to do with movement disorders and whatnot. But it's excellent for migraine patients because, remember, when the frontal lobe's firing well, that really reduces the need for oxygen in the back portion of the brain, because it slows down the activity when those parts of your brain are being overstimulated. So these are the therapies that we do. There's a few of them that I have not gone over, but every patient is different. So when we do an exam, we want to specifically look at your nervous system, find out exactly what's causing your migraine headaches. Your migraine headaches may be purely neurological. They may be metabolic. They may be due to low blood sugar combined with a neurological problem. You may have a biomechanical problem in your neck combined with a neurological issue, combined with poor adrenal gland function, or you may have problems with your female hormone panel. So we need to look at every one of these things, and we need to look at them from an integrative preventative medicine perspective to get the best results. And that's why we have such phenomenal results in taking care of patients with migraine headaches and tension headaches, because we want to look at all the possibilities that can be causing it. We want to leave no stone unturned in finding out why you have the problem. So if you're serious about migraine headaches, tension headaches, and you really want some relief, and you're looking for some answers, and you're not happy with all the different medications that every doctor seems to hand you, what I would recommend you do is listen to some of our testimonials, go to our website, www.askdrchildsdr.com. Give our office a call, 610-518-3370, and let one of our assistants at our front desk know that you'd like to come in for a functional neurological exam to find out the exact cause of your migraine headaches or your tension headaches. So give us a call, and we'll talk soon. Thank you.